family nurse practitioner student, and I'm going to be doing your cranial nerve and neuro exam. Is that okay with you?
Yes.
Can you please state your full name and date of birth?
Felipe Ramirez, 1 May 1989.
Okay, good. I'm going to start off with your first cranial nerve, which is olfactory. It's checking for a sense of smell. I'm going to have you close your eyes and close one there. And you're going to smell and tell me what you're smelling.
Cinnamon.
Good. Now close the other one. Tell me what it is.
Coffee.
Good. Now, I'm going to check the second cranial nerve, which is the optic. I'm going to check with a Snellen chart. We're 6 feet away. And I'm going to have you cover one eye. We're going to do it in both eyes. Cover your eye, and then we're going to start at the fourth line, and we're going to work our way down.
DHJBS.
Good.
EPTZO.
Good.
CFDHJ.
Good.
LTFEH.
Okay, visual cuties 20/20 on your right eye. Now I'm going to have you cover the other eye. Okay.
DHJBS. EPTZO. CFDHJ.
Good.
LTFPH.
Visual cuties 20/20 bilaterally. Good job. Now I'm gonna do a confrontational assessment, which assesses peripheral view. We're gonna both close the same eye, and then I'm gonna apply my hand through different visual fields, and you're gonna tell me when you see them. Okay? When you see my hand.
I see it.
Okay.
See it. See it.
Okay. I'm just gonna pause.
Yep. Yep. Yep.
Good. Now let's do the other hand. The other eye.
Yep. 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 Yep.
Good. Next, I'm gonna do a fundoscopic exam. All right. Look straight ahead, and I'm gonna look. I'm gonna look for the red reflex. Look in, look at the posterior view of the retina, the posterior structures of the retina. I'm looking at the optic disc, optic nerve. I'm looking at the vessels, making sure there's no dilation, constriction. Good. And now I'm going to look at the other eye, right eye with right eye. I'm going to look at the red reflex, look in at the retina. I'm looking at the optic disc, optic nerve. I'm looking at the vessels. I'm looking for a venous pulsation. Good. Taut. And now I'm going to be, I'm going to start doing cranial nerve number 3, 4, and 6. These are all going to assess the extraocular movement of the eyes. 3 also includes pupillary constriction and consensuality, meaning if when I shine a light and one constricts, the other should constrict as well, or dilate as well. 4 is trochlear, and 6 is abducens. 3 is ocular motor. So I'm going to shine a light at you. Give me 1 second. My pen light. Okay. Good. Good. Pupils equally round and react to light, 4 millimeters, and consensually. Now I'm gonna have you look at my finger, and I'm looking for any jerking or movement of the eyes, known as nystagmus. So I'm gonna have you follow my finger. The lateral movement is cranial nerve number 6, and the downward and medial is the trochlear, which is cranial nerve number 4, those are intact, free from nystagmus. We're going to do cranial nerve. We're going to go back to cranial nerve number 5, which is the trigeminal. It's the trigeminal, which I'm going to have you I'm going to have you clench your mouth and kind of try and open Good. I'm gonna assess for dull and sharp. Dull and sharp on his forehead, his cheek,
Dull.
and his jaw. Okay.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, sensory motor is intact. That was trigeminal cranial nerve number 5. We already did cranial nerve number 6, so we're gonna go to cranial nerve number 7, which is facial. I'm gonna have there's the upper, and the lower 7 cranial nerves. So the upper, I'm gonna have you wrinkle your forehead, and now for your lower 7, can you smile, puff out your cheeks? Good. Next, I'm gonna do the acoustic. It's gonna be I'm assessing his hearing throughout the exam. He's been able to follow. He's without constantly being like, huh. I'm gonna start off with the whisper test. I'm gonna say something. He's gonna cover the opposite side, and he's gonna say it out loud.
Apple.
Good. Now I'm gonna say something else.
Banana.
Good job. Next, I'm gonna do the Weber's test with the tuning fork. I'm gonna strike it, and then he should be able to hear on both sides. I'm assessing bone conduction.
Yes.
Good job. Next, I'm gonna do the REN test. Is gonna be done bilaterally. It's checking for air conduction versus bone conduction.
Yes.
Good.
No. Yes.
Good. Weber's test and the REN test is both intact. Now I'm gonna do cranial nerve number 9 and 10, glossopharyngeal, and the vagus nerve. It's the glossopharyngeal and the vagus nerve. It's going to be assessing for swallowing. So can you please swallow for me? Now I'm going to can you please say ah? I'm checking for the uvula, make sure it's in midline. I'm looking at his palate. Good. That's cranial nerve number 9 and 10. 10 is vagus. 11, I'm going to do the accessory muscles. I'm going to do the trapezoid and sternomastoid. So can you push up? Push against my hand. Push against my hand. Good. Now I'm going to do cranial nerve number 12. Cranial nerve number 12 is hypoglossal. I'm going to have you stick out your tongue and then move it side to side. Good. And I'm going to use the tongue blade and I'm going to assess for strength. Up, down. Good. Intact. Next, I'm going to assess his level of consciousness. Throughout, I've been able to assess that he's been following commands. His speech is clear. He was able to tell me his name, date of birth. Now, can you tell me where we are?
Clinic.
He knows his orientation. What day is it today?
12 March.
Good. He's oriented ×3. His speech is clear. Now I'm gonna do a memory question. It's a remote memory. Can you tell me what you did for your birthday last year?
I was on a vacation in Cancun.
Okay, and what did you do?
I went to the beach.
Okay. Next, I'm gonna do reasoning. So if a house was on fire, what would you do?
Dial 911.
Okay, and I'm gonna do a judgment. I'm gonna assess his judgment. So if there was envelope on the street and it had everything filled out with the stamp, what would you do?
I'll give it to the post office.
Okay, good. That about sums it up. We're gonna start now. I'm gonna assess your gait. I'm gonna have you walk. Make sure that we can see. Okay. Good. I'm gonna have you walk straight that way. Can you see it? Yeah, good. Walk back. Next, I'm gonna have him do a tandem walk, which is heel to toe, heel to toe, heel to toe. I'm assessing his gait. Good. Symmetry. Coordination. Great. Now I'm going to do, can you please do, can you be on your tippy toes and walk that way? Now be on your heels and walk back. Good. Now I'm going to do the Romberg test. I'm going to have you stand side to side. And then I'm going to have you, can you see? And I'm going to have you close your eyes. And then he has coordination. He's not moving. He's not swinging around. Great. Now, I'm going to have you, I'm going to push down and see he's able to hold his hands up. Positioning is great. Now we're going to have you sit down, and I'm going to do the rapid alternating movement. So good. And next is going to be position sensory, the perception of sensory. So I'm going to have him close his eyes, and I'm going to move his toes either downward or upwards with his eyes closed, and he's going to tell me what it is, okay? So I'm moving his toes.
Down.
Good.
Up.
Good. Now I'm moving his fingers.
Up. Down.
Great. Good job, Mr. Ramirez. You can open your eyes. And next I'm going to do graphesthesia, which is I'm going to write a number on his hand, and he should be able to tell me exactly what I wrote.
3.
Good job. Next, I'm going to assess his motor function. The whole time I'm assessing his strength. I'm checking for any bulk, tonicity. Obviously his strength holding himself upright, but I'm assessing on both sides. So I'm assess his major muscle groups: deltoid, bicep, tricep, his hand strength, hand grip. So I'll start off. Can you hold your hands out, and then can you push? Okay, push against me. Good job. So now can you have your hands open, and I'm going to try and close them, and you should not let me. Good. Now have your hands closed. I'm going to try and open. Okay, good. Now hand grip. Good. And I'm assessing all of this bilaterally. I'm going to have you push down. Okay, I'm checking the abductor and adductor muscle groups. Good job. Now I'm going to do it on his lower extremities. For this, I'm going to have you lay down. I'm going to assess his major muscle groups, which is his quadriceps, his hamstring. I'm going to assess his abductors and adductors. Let me make sure it's able to be seen. I think so. So I'm just going to have you kind of push up. Good. Up against my hand. Push down. Good job. Push down. So bend your legs. And I'm going to try and close them, and don't let me close them. Good. Abductors. Good job. And then push down. Good. Up. Down. Good job. Plantar flexion. Just push. Push. Good. Mr. Ramirez, you can sit back down. Now I'm going to assess his sensory function. This is going to be, I already compared everything to both sides. I'm going to assess his sensory function through a cotton. Give me one sec. Cotton and a prick. I'm going to check his pain sensation and his tactile sensation on his upper and lower extremities. So, close your eyes. Sorry, thank you.
Good.
Good.
Sharp. 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 Dull. Dull. Sharp.
Now I'm going to do his lower extremities.
Sharp. 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 Dull. Dull. Sharp. Soft. Dull.
Now we're gonna do, I'm just gonna have you, I'm gonna see if you assess vibration. So I'm gonna have you close your eyes and I'm gonna assess. Okay?
Yes.
Yes.
Yes. Yes.
Good.
Yes. Yes.
Okay, good. Now I'm gonna assess his reflex, and I'm gonna assess his bicep, his tricep, his patellar, and his Achilles. And let's begin. And I'm gonna check on all 4 extremities. So, good. I'm gonna hold his arm, make sure. I don't think you can you turn a little? I'll kind of go like this. So I'm gonna hold his arm upright. Good. Now I'm gonna, good. Good. And then he should be having his feet a little bit more dangling, but for the video, I'm gonna assess his patellar. Good job. Good job, Mr. Ramirez. Now, can you stand up and put your, okay. Good job. And let's do the other leg. And while you are right there, don't move. I'm gonna assess his for Babinski, like a baby with flare, but an older adult. You want them, so I'm gonna assess going up. Good job. Now you should have a reflex. Good job. And that concludes our exam. Thank you.